All right, hi, and welcome to the diabetes Zoom call. Today we're going to be attacking not just what diabetes is, but we're going to attack the different types of diabetes. We're going to be attacking what causes it, the treatments for it, and everything that is diabetes, from type 1, type 2, gestational, or even pre-diabetes. So if you want to write some notes down, by all means go ahead, but this is going to be recorded. So let's get started. All right, so diabetes, and I chose this cover as kind of an interesting thing because when we think of diabetes, we think of blood and what's in our blood and everything like that. But actually, this is the symbol for what diabetes is, and it is. Whoa, give me 1 second here. And it is actually completely different than that. And what diabetes symbol is actually a blue circle. And what the circle represents, I have no idea. I honestly couldn't tell you. But this is what it looks like. So whenever you see this symbol, this is the universal symbol for what diabetes is. And honestly, I looked into it thinking, like, does it have a purpose behind it? And I couldn't find one. So I can't explain that one there. But one of the reasons why diabetes interests me is that 1 in 11 people are going to suffer from it, which is a staggering number and is actually on a steady increase. 1/4 of the people with diabetes are not going to be diagnosed. They're going to continue their lives suffering with the side effects of this, and they're never going to find out what's wrong with them. It is the 7th leading cause of death in the U.S., which is pretty crazy. It's up there with the big boys like heart disease and cancer, and well, a lot of the big ones. And like I said before, prevalence is on the rise. So diabetes is a very big issue, especially in our society. Diabetes mellitus is the main diabetes, and that's the one we think of when we think of blood sugar. There's 3 types classically. There's type 1, type 2, and gestational diabetes. I'm also going to be attacking a 4th one called pre-diabetes, but it's not technically diabetes mellitus, so that's why I didn't put it on the list here, but we'll talk about that one. The common theme with diabetes mellitus is that no matter the type, unchecked diabetes results in one thing, and it's dangerously fluctuating levels of blood glucose or blood sugar. Now, why is that significant? It's significant because sugar is what our body uses for its main source of energy. And with diabetes, the sugar gets into the blood, but the sugar doesn't enter into the cell where the factories of the cell are needed to convert it into what we use called ATP. When that doesn't happen, the cells will starve, so they have to look elsewhere. And what they do is they start breaking down protein and fats. And when that happens, that's an abnormal form of energy creating. And what it does, its byproduct or its pollution are these ketone bodies. And these ketone bodies, all you need to know about them is that they're not natural and they're not normal. And when they build up, they're especially damaging to the nervous system, but damage all organs across the body. And if you know somebody that has type 1 or type 2 or gestational diabetes, it is very important they watch their blood sugar, because if left unchecked and their blood sugar is dangerously high, and their cells are starving, they're going to enter into something called ketogenic acidosis. And what that is a horrible, horrible change in the system where basically all the organs start shutting down, and your brain is one of them that gets attacked first. It leads ultimately to diabetic coma and very shortly death. And on the left-hand side, you can see kind of a graphic that has some of the symptoms of acidosis, and they're very scary. I don't know if a lot of people would have arrhythmia or their heart's beating at different rates and they're getting shortness of breath. They're not thinking they're in a good place. So this is something very serious. Also, yeah, even if the blood sugars are regulated decently, which means you're for the most part doing pretty good, only once in a while your blood sugars get out of control, this still causes irreversible damage to the nervous system. And anybody knows diabetes, you always hear like that little joke that gets thrown around and you can get your foot cut off kind of thing. And that's a very real factor for things like diabetic peripheral neuropathy. And what that is damage caused by this imbalance. It will start attacking the distal nerves and blood vessels, so the ones that are in your toes and your feet and your fingers and your hands, and it'll start attacking those first, and then it'll kind of backtrack its way up the body. I'm going to use a patient as a reference. Obviously, I'm not going to say his name, but I had a gentleman come into me a few years ago, and his legs were basically like a deep pomegranate purple. And it's because of this damage from diabetes over a long period of time. Even though he was a type 2 and he was keeping it under control, it's something that progresses no matter who you are. And it doesn't just affect those areas. You hear of diabetic retinopathy, people going blind, where you have hemorrhaging of the blood vessels in your eyes. Like I said, it affects the feet and the blood supply and the nervous system there. People get sores and they can't even feel their feet get cut open, and there's open wounds and they can't even feel them anymore. You get tingling and numbness, and the same type of thing you get in your feet and your hands. It attacks your kidneys, and you have something called proteinuria, which is your body excreting protein through the urine. And then whenever you see that's a very bad thing. But it also increases how much you're urinating too. So people that are thinking they're diabetic, you see them, they're peeing all the time. And don't worry, I know there's a lot of people probably listening with, holy crap, I pee like every 5 minutes, I swear. It's doesn't mean just because you do that you have diabetes, right? But it also attacks different areas in the form of fatigue. You're feeling constantly drained, have no energy, you just feel like you've got nothing in the tank. You're also going to be very susceptible to diseases, such simple things like colds and flus. But you're also not going to heal very well. You're going to find these things just linger, and you always have this, and it's months of this. It also affects your weight, and it fluctuates your weight up and down. A lot of people think of diabetes as swelling, but that's not always true. Some people lose massive amounts of weight from being diabetic. And probably the biggest one is it affects your cardiovascular system, which is the #1 killer in our Western society, probably if not worldwide. So here are some trends of diabetes. And like I said before, rates of all types of diabetes are on the rise. They are getting worse with time. Type 1 diabetes mellitus used to be considered a rare disease. It almost never happened, but it was also considered fatal because we didn't know what to do with it back in the day. So new advances give people a pretty good life expectancy, as in they're not supposed to die fairly quickly. In fact, they can live a fairly regular life, but that life is going to be full of complications, a need for consistency, and increasing costs for medication and supplies. Type 2 diabetes used to only occur in adults over the age of 40, but due to constantly decreasing quality of food, education, lack of exercise, children of younger and younger ages are getting diagnosed with it. And I know I talked to my father as a chiropractor. I'm a second generation chiropractor, and he talks about how it was originally referred to as adult onset diabetes, and you only see it in people over the age of 40. But I know other nurses that talk about it too, is that they're seeing children below the age of 10 being diagnosed with type 2 diabetes. And it's sad because this is strictly lifestyle. This is not this. They don't consider genetics to be a big precursor of this anymore. You can eliminate this completely and reverse it with just your diet. Gestational diabetes is very similar to type 2 diabetes. It's more or less in pregnant women who become more susceptible. They had a predisposition, but now they have more of one because of the stresses and changes to their body. But it's treated pretty much the same because it is the same stuff that you would do with a type 2 diabetic to reverse it as you would with a gestational diabetic. And pre-diabetes, the pre-diabetics are numerous, and they're constantly growing in size. And in fact, there's more pre-diabetics out there than there are of all the diabetic types combined. And many people don't recognize the symptoms of being pre-diabetic, the things we talked about, the fatigue, the urination, the numbness and tingling, everything like that. And these things can be fairly subtle. And a lot of the times they wait and wait and wait, and all of a sudden, boom, it's too late. So the ultimate cure for diabetes is really never giving it a chance. So let's talk about type 1 diabetes to begin with. So type 1 diabetes is much more severe, but much more rare than the rest of the diabetes. It starts with a little bit of anatomy here, and what we're looking at is the pancreas. And the pancreas is the part of the body that secretes not only insulin and glucagon, which are in control of your blood sugar levels, but it's in control of a lot of other digestive enzymes. So it's extremely, extremely important for the body. And with the type 1 diabetes, there's these cells called beta cells, and they're found in the islets of Langerhans. I swear I could not mess that up, but I did. But what happens is the beta cells secrete insulin, and when they stop secreting or become damaged, the body has no way of controlling the blood sugar. So what happens is this person becomes type 1 diabetic. And it's classically referred to as an autoimmune disorder or a metabolic disorder too. But that is changing with certain research that's coming out. It was referred to as juvenile diabetes because it was found mostly in kids, either within the first few years of their lives or even into adolescence and prepubescent and pubescent teens. So originally thought that the beta cells were completely damaged and incapable of recovering, and they secreted no insulin. And now they're finding that the beta cells do produce a bit of insulin, but it's just not enough to regulate what the body is taking in day to day. So, like I said, it was once believed to be entirely genetic, but recent research shows that it's actually triggered environmentally. They're looking into foods, they're looking into specific times, and more importantly, they're looking at, okay, what's happening in the womb? What is the mom eating that is throwing things off, that could be damaging the baby as it's growing through these critical periods, especially during the first trimester, and then the critical periods of life. As their body's developing, they start introducing new foods that have different complex sugars to them. How is the body responding? And it's really important for children at that age to eat healthy foods, natural foods. In some cases, they even found with type 1 diabetics that if you were to control their environment around them, you can drastically change their condition. And some researchers state that you could possibly reverse it with lifestyle choices. Now, that's fairly bold to say because there's a ton of research pumped into diabetes because of how prevalent it is. And that's great that there could be a bright future, but in the meantime, it's very important to realize that this is not a cure. This is simply a new area of research that they're looking into and still needs a lot more research to go in that direction. So type 1 diabetes needs strict nutritional programs to make a difference. Sugar is the first thing I'm going to attack, and I will attack that later too, but refined sugar is an absolute no for type 1s. Natural sugars that have a low glycemic index are safe. And what I mean by low glycemic index is that not all sugar is the same. Carb in, carb out is just not a true statement. A low glycemic sugar will enter the body, it'll go into the bloodstream, and it'll be a gentle rise over hours of the sugar being kind of distributed through the body. High glycemic foods will have this massive influx. And so you'll see this blood sugar rocket up, and then just a half hour later, it'll rocket right back down and plummet. Those types of foods are incredibly dangerous for diabetics because their body can't keep up. It's already reeling and trying as hard as it can. It won't be able to keep up with it. But even more safe with sugar is to be paired with soluble fiber. And soluble fiber is what we find in fruits and vegetables, and it's in the peel. If you were, I eat kiwis without taking the little fuzzy stuff off of it. And I know that may sound weird for anybody who's tried or not tried it, but it's really not that bad. But that fiber that's in that peel is so important. And the fiber that's in an orange peel is tremendous. We need that fiber. And what it does when entered into the body is that it helps the pathway of sugar, and it slows the sugar down. So it's really important that we're not just throwing all the sugar into our body when it's not in the right format, when it's by itself. The body doesn't know what to do with it, and it just overloads it. So like I said, it helps mediate bad cholesterol, helps digest and eliminate excessive fat, and a major component of proper glucose transport. So many people that follow this strict nutritional choice can change how much insulin they need. And that's one of the biggest ones is people that change the diet find that, okay, I don't need to inject myself with as much insulin to keep my blood sugar at a certain level. And that's huge. Now, the theory behind that is maybe the body is becoming more sensitive to insulin. That little bit that the body's putting out, it's using it better. But the other theory is that the beta cells, which weren't producing any, are healing. They're getting better and they're producing a little bit more. So that's the new field of research. And that type of change is so drastic for a type 1 diabetic because it creates this stability. And if you've ever known anybody with type 1 diabetes, there's a constant fear, especially when you're younger or when they have children, of like, you don't pay attention for a little bit and things can go south very quickly. So that consistency and stability is absolutely massive in life for a type 1 diabetic. And we'll discuss exercise in a little bit. It kind of ties into everything. So as you roll into type 2 diabetes, it's by far the most common. Whenever you hear diabetes, if you had to guess, it's likely going to be type 2. Rarely is it type 1 or gestation. And I think you'd be able to tell if the person gestation sometimes, but you never ask. So the causes are actually more than one. It's not a single cause. One of the causes is that the body becomes insensitive to insulin. So insulin is dumped into the system, but the body doesn't know what to do with it. It doesn't recognize it properly. The other side of it is that the liver could also be malfunctioning. It's pumping out way too much sugar, and the body just can't keep up with it. Another cause is that there's a miscommunication. There's some sort of interference between the signals being sent by an organ or a cell to the other organs and cells that regulate this, and they're just not getting the message. So one's saying more insulin, and the other one's going less insulin, and it just creates a big problem. And the last one is, like type 1 diabetics, is damaged beta cells, so that there's not enough insulin being put out by the pancreas. So medication can help mediate these symptoms, but like all medications, they're not built for cures. Medications don't cure it. They simply make the symptoms better, allow you to function, ultimately hoping for a cure or for the body to heal itself. So as you roll further into type 2 diabetes, we find out what causes it. And the major cause is lifestyle. It is 100% lifestyle. And it's the negative lifestyle choices that result in your poor health. Obesity is the biggest one. And it's paired with high sugar intake, saturated trans fat intake, lack of exercise, stress. Urban residence is a big conversation. Going from an active farm lifestyle where you're up and moving constantly to sitting on the way to work, sitting when you get back from work, sitting at work. It just creates a lot of stagnancy within the body and is a huge cause of diabetes. So similar to type 1, it can be treated through lifestyle change, but unlike type 1, it has a much greater chance of being cured. Type 2 can be reversed, and in many cases, if taken very seriously and stepped into properly by the person suffering, they can reverse the future, which is really good to hear, because nobody, or hopefully in the future, type 2 diabetes is all but eliminated. So gestational diabetes obviously comes along with pregnancy. The stress, like I talked about, that already made susceptible women even more prone to acquiring the condition. They get it quite easy. It's very similar to type 2 diabetes. The significance of it is that it drastically increases your chances of acquiring type 2 diabetes later in life by about 40%, which means that you get it when you're pregnant, you have almost a 50-50 chance of getting it later in life, which isn't good. But it also has the potential to not only harm the mother, but it has a potential to endanger the baby's life in vitro and postpartum. Meaning there's respiratory distress syndrome is a big one. Some of the babies can go into seizures when they're just born. Later in life, they can be susceptible to blood sugar issues and have diabetes of their own, even type 1. So it is fully treatable, much like type 2 diabetes, through lifestyle change and figuring out the little things that you can do for these pregnant women. So pre-diabetes is a really big thing. And I love this picture I put up because I always use the analogy that we need to listen to those little engine lights that come on in our body giving us hints. And like I said before, there are more people that are pre-diabetic than all of those diagnosed with diabetes combined. It's a staggering number. I think it's something like almost close to 100 million people in the United States alone are pre-diabetic, which is pretty much a third of the population, which is just ridiculous. Pre-diabetics are people that basically have elevated blood sugar, but it's not quite high enough to be diagnosed. And I'll go through those numbers in a little bit, so you can have some information for yourself or for somebody you know. So those in this range, they literally carry their future in their lifestyle. If they don't make a change now, it could progress. So how do you know where you are with diabetes and if you're pre-diabetic? You got to listen to your body. Like I talked about, the symptoms like the very tired all the time, increased urination, numbness and tingling, all these things, they add up to something bigger. And the tests that they use, one of them is called the fasting plasma glucose, or the FPG, and it's performed by a lab. It's very easy to get done even in Canada. And what they do is they basically fast you. So you don't eat anything for 8 hours. They test your blood sugar level. And if you're between 70 to 100 milligrams per deciliter, you're good. You're solid. If it's above it, now the numbers are looking weird and they want to go further into testing. And what they do after that is something called the oral glucose tolerance test. And what they do is they fast you like they did with the other tests, so you don't eat. They take your blood sugar level, and then what they do is they give you a 75 gram of sugar in a liquid solution to kind of drink back. And if you've ever had it, it's just really, really sweet. And what they do then is they basically introduce that high glycemic food into your body, and they're going to watch your blood sugar rocket up. And what they're going to do is for the next 2 hours, they're going to test you once an hour to see if your blood sugar is coming back down. And you can see on the right-hand side as we blow it up here that a diabetic subject, the blood sugar stays way too high, and a normal patient actually comes up and then it'll start coming back down. Your body's doing what it's supposed to do. So normal is below 140 milligrams per deciliter. Pre-diabetic is 140 to 199 milligrams per deciliter. Diabetic is over 200 milligrams per deciliter. And gestational diabetic is over 153 milligrams per deciliter. So these tests are actually fairly easy and non-invasive. As much as some of us don't like being poked by a needle, they're still not going to be taking too much from you or doing any damage to you. But if there is a chance that diabetes is a very real thing with you, then looking into these tests are quite easy and can be done pretty much any center that can draw blood. So let's roll into some treatments. So we have our little friend here doing some exercise with, I hope that's a wig. But the urban living we talked about, and the increasing sedentary lifestyles are massive components of why diabetes is increasing in our society. So both prevention and treatment. Exercise is both a prevention and a treatment for all types of diabetes. And like I said, as much as type 1 may not get cured by it, it can create a substantial difference in their lifestyles. And like we also talked about, obesity is one of the main causes of diabetes. Exercise is going to treat all of this. But exercising regularly is a necessity. What it does is it increases insulin sensitivity, so it makes you more capable of handling those rises and dips in blood sugar. It uses up glucose inside and outside of the cell, stopping it from building up. So if you're not exercising but you're still eating, you're going to have an excess, which usually turns to fat. But if you're becoming pre-diabetic, your body is losing the ability to properly store it. And do we all know what the best exercise on the planet is? It's the one you're going to do. So find something that you like to do, whether that be going for a walk. Sometimes it's as simple as gardening. I had that a lot. It's like, is that enough? And you know what? Yes, it is. If you're not sitting around and you're out doing something, then absolutely. But pick something that you will actually do. Make it realistic. The American Diabetic Association recommends that aerobic and resistance are the best. And I would agree with that because it utilizes so many different parts of the body all at once, making you maximize the time exercising. And you need to be doing this for 30 minutes minimum for 5 days a week. Now you can condense this, and I know a lot of people like to do things called high intensity interval training, which is basically going absolutely bonkers for like 10, 15 minutes and then you're done. And hey, that's great because you're using so much force and energy all at once that you're getting your workout done way quicker. Work smarter, not harder, right? And then very important to have a low glycemic food after exercise. Many people think that having carbs after exercise is kind of counterproductive to what you just did. It's actually very not true, and I'm going to go through that in a little bit here. So nutrition. Nutrition is by far the most significant factor for controlling diabetics, or if you are becoming diabetic or don't want to become diabetic. So food quality has deteriorated drastically over time. Many of us know this, especially if they lived in a farm setting or had parents that still lived in a farm setting, is that our food, we don't grow our own food anymore. We live in urban societies, most of us, and we get our food from massive distances. It's shipped long distances, picked too early. It's now genetically modified, meaning that they're now able to create plants that make their own pesticides, which is toxic for us. And it's just lessening our food quality, and they spray it with poison to make sure it ripens so bugs don't eat it. And it contains lots of fillers, lots of colors, preservatives, flavors, etc. Our food is basically becoming less like food. So the main component necessary for diabetics in regards to nutrition is that they have low glycemic foods. We brought that up before. Soluble fiber, which we also talked about. This is for all diabetics. Antioxidants, really important. And when you're diabetic, you're creating more damage to your body, and you need to be able to counteract that damage with antioxidants and get rid of those free radicals that could be causing that damage to your nervous system. You need a proper balance of micronutrients. Those are the vitamins, the phytonutrients, the minerals that you find in your food. You need to have a proper balance and avoid the damaging foods. For diabetics, alcohol, foods with refined sugar, saturated or trans fat, and caffeine are the highest on the list for damaging foods for diabetics. They cause your body to make itself much, much worse. And we need more whole foods. There's an ideology out there that we need to have our vitamins and we have a vitamin deficiency. That's not true. We have a whole food deficiency. We need to go back to our sources and what our bodies were designed to take in, which is not a part of the apple, it's the apple. It's not a part of the broccoli, it's the whole thing. So whole foods are food that has been processed or refined as little as possible and is free from all additives and other artificial substances. So take a look at this. This is the Harvard Healthy Eating Plan. And it was released, I think, a few years ago now, but it's still probably the most accurate one that I find. You can see that it has a lot of things on here. We got our fruits, our vegetables, our whole grains, healthy protein, water, and healthy oils. And one thing that stood out to me immediately is that, where are the dairy products? Well, Harvard has actually found that, and it says on the top right there, that, well, basically you limit it to 1 or 2 servings a day. It shouldn't be a staple anymore. But you see, half the plate is fruits and vegetables, a quarter of the plate is whole grains, and about a quarter of the plate is healthy protein. Then you have your water and your healthy oils. Now, out of our Western society, what do you think any one of those we don't get? Now, I'm pretty sure I get enough whole grains and protein. I know I eat enough meat. I'm up to about 3 liters of water, so I know I'm pretty good there. But the one across the board is fruits and vegetables. So let's go back to this. We need more. We need more fruits and vegetables. And the proper amounts of serving is 9 to 13 servings per day now. And we need to eat the rainbow. Every single color of fruit offers something different that our bodies need. And that's probably why we can see all those different colors, right? So simply figure out, like, yeah, I need the purple one. Okay, I need the green one. I need the red one. We also need to look at quality over quantity. We need to look for local food. We need to look for organic food, fresh food, stuff that isn't sitting on the shelf for a month and still looks perfect. The non-GMO foods, these are all going to be a big difference because, like I said before, our food is becoming less like food. So we're having to eat more of it. And that's why those servings are so high. A pound of lettuce is no longer a pound of lettuce. We need to almost, in some cases, double, triple, quadruple, or even more than that. So as you roll through nutrition a little bit more, diabetics that eat a diet high in fruits and vegetables every day have been shown to have, like we talked about, lower amounts of insulin injections. They have less high and low spikes in their blood sugar. It's much more mediated across the board. And type 2 and gestational diabetes has been cured through strictly just nutrition and making sure they're eating what they need to eat. And it also greatly increases quality of life. But it's not always that simple. Very few of us can eat that 9 to 13 servings of fruit and vegetable per day. I know I can't. I try. Like most of the days I'm pretty good. I can get usually around that level, but most days aren't most days. There's days where I'm traveling. There's days where I'm really busy. There's days where just nothing falls together, and we all have those days. But diabetics, more than anybody, need that consistency. They need to have the same thing every day to make sure that they're not having these drastic fluctuations. So they need to bridge the gap. And how do you do that? You do it with supplements, meal replacements. What do you do? Well, let's take a look at supplementation. Now, this is a supplement label taken from, I forget what, but it looks pretty good, right? If you read it, what it's got listed is got a lot of the vitamins, it's got a lot of B6, or got B6, B12, but it's listing them as 100%, 166%, 133%, 200% of niacin. And it looks really, really impressive. Well, this is a label on an apple. And what it shows there is not very impressive. It's got a whole 5 or 6 things listed. We've got a bunch of zeros and 6 and 12%. But these labels are very misforming because what's actually in an apple is this. And this is just one of, I think, 10 to 12 pages of what's actually what we even know. We're probably going to find many more compounds that are in an apple. This is just, I think there's something like 12,000 different phytonutrients we know of in a single apple. And the body knows what to do with that. Our bodies have been designed to eat things like this. It knows what to do with all these different things, all in unison. It's called synergy. The body just knows what to do with it. So something I truly live by is a product called Juice Plus. Now, I've been on it for 13 years, and I went on it originally for an injury that I got that I just wasn't healing from. And we kind of panicked because it was going south, and we thought, hey, fruits and vegetables are good, it won't hurt you. So I went on it, and it made a massive difference in my life. I talk about a fair amount in my practice. As a chiropractor, we do have heavy nutrition training, but there's one group of people that I don't push things very often, but I'm fairly aggressive with this, and it's diabetics. And I'm going to talk to you a little bit about why. Number one, this is what's in it. It's all the things we talked about have been shown to help diabetics significantly, immensely. It's just a rainbow of fruits and vegetables of the highest quality. On top of that, it's non-GMO. It has third-party testing to come in and make sure that nothing is wrong with it. So it doesn't have things in it that could hurt somebody like a diabetic. It's backed by so much research, it's ridiculous. As a health practitioner, I better be able to back up what I'm saying. If somebody comes to me with a question, I can go, here, look at this peer-reviewed journal that's top in science, medicine and science and sports and exercise, and this is what it states. So that really backs me up. But more importantly for diabetics is this. There's no sugar in it. So diabetics can get told one of two things. One, avoid all sugar and only take certain amounts of sugar and be very careful with your sugar, and sugar is bad. Or two, they get told proper things like certain sugars are better than others, fruits and vegetables are the way to go, low glycemic foods. But many, if not most of the diabetics that I talk to and that I work on as a chiropractor, they don't know that not all sugar is the same. And so what they do is they avoid things like fruits and vegetables because they think it's going to hurt them. So Juice Plus literally gives them what they need without giving them the risk of any type of sugar because it has no sugar in it. So another one that I absolutely love is the Juice Plus Complete. Now, this is basically a meal that you can take with you. Now, it's decent in protein, it's gluten-free, it's non-dairy, it has lots of fiber in it, which is very important, it's vegan. More importantly, it's low glycemic too. So the fiber and the low glycemic are going to go together very well for any diabetic. So if you're on the run and you're not too sure how you're going to be eating that day, you know you need to be watching your blood sugar. This is something that you can carry around with you and take after the gym. In the morning when you're running around during the day, if you have kids and sometimes your schedule gets thrown off by their craziness, this is something that can really help bridge that gap. So this is why I push Juice Plus with all my diabetics patients, because I know what they can do. And the reasons is that it has more research than any product of its kind. It only contains fruits and vegetables, food, and is tested by a third party to make sure there's not something that can hurt anyone. It has no sugar, so it's safe for diabetics and keep it in their diets without endangering their lives. And more than anything for diabetics, I found that it creates consistency and peace of mind. There is a constant fear of whether or not they're going to be able to get what they need that day or that week or whatever it may be. And I find with my patients that go on this, it just seems to take that edge off. They're able to focus on the things that are a little bit more important. So your health is in your hands. And ultimately, it comes down to one simple change. I always tell it to my patients. They're going to try to make their lives a little bit better. Don't do it all at once. Don't go crazy. You probably won't be able to keep up with that change. Do one thing at a time. And make choices that become healthy habits you can carry through the rest of your lives. And what you put in is what you get out. Ultimately, it's about creating a long-term goal and holding yourself to that. Bruce Lee said it best: long-term consistency trumps short-term intensity. And a quote that I absolutely love to live by is that the doctor of the future will give no medicine, but will interest his patients in the care, in the human frame, in diet, and the cause and prevention of disease. As a chiropractor, I've been practicing for 3 years now in the Edmonton area, or just over 3 years. And in my short time, you're constantly learning, constantly going, you're realizing that our society is so focused on fixing something after it's broken rather than prevention. And something I always love to end with is there's two types of people on the planet. And there's the people that see something in their life with their health that they can change. And they decide to, you know what, I don't care what it takes, I'm going to do this. And they just use their will, they push through and they make it happen. And they're like, nope, I'm going to change this, this is going to happen. The other set of people are the people that wait for something bad to happen to them. They wait until somebody they love or themselves have a scare health-wise. Now, in health, there's no such thing as making a good choice too early, but there is such a thing as waiting a little bit too late. You may never get that second chance back. I go back to that patient I talked about, the gentleman that came in 2 years ago with his legs being completely discolored. Well, this gentleman was morbidly obese. He had type 2 diabetes. It was being treated with medicine, but he wasn't doing anything with his lifestyle to change it. And we had a conversation saying that, okay, you need to make some changes. You need to make some pretty drastic ones, because if you don't, things are going to turn south. And 2 weeks ago, he ended up dying. And he died from heart failure, but related directly to his lifestyle. And he was only 62 years old. And there's probably a few people sitting here that are either that's right by your age or a little bit younger than you. And it's a very sobering thing to watch this, because he leaves his family behind. And they asked the question of what could we have done? And the conversation at the time where I came in was, at this point, it was almost too late. And when he decided to start making a difference, he wasn't able to pull himself out of his hole. And it was a hard thing to watch, because as a practitioner, you feel helpless. You feel like there's nothing you can do. So I urge anybody that knows somebody that has diabetes, is pre-diabetic, or is just living a life that may be circling that diabetic drain, to give them this information and let them know. Because as a practitioner, it's my duty to spread this information and let people know what they can do to make their lives better, higher quality of life, live longer, so they can do all the things that they want to do and not live a life of withering and falling apart and waiting just kind of for the end and doing nothing about it and turn around saying, well, there's nothing I could have done. So hopefully this hit you and you tell somebody about it and they learn a little bit about it, and I hope you did too. But thank you very much for your time. And I hope that you learned a little bit, and only took up about 35 minutes of your time, and I hope that was good.